Hi everyone, this is Gail from Align Osteopathy. What I want to do for you today is a quick demonstration about how you would start to practice your hand expression for feeding your infant. And this can be done from about 36 weeks, as long as there isn't any worry that you might go into labour a little bit early. So if you are worried about anything, speak to your midwife. So we're going to hopefully start to practice this, and then over time you may be able to harvest some colostrum, which we've got the little syringe for. So to start off, you need to make sure that you are really relaxed. I usually tell my patients to get the area nice and warm, so it's nice and warm in the room that you're going to be doing this in, and you're sort of free from restriction, and you haven't got any worries about anyone walking in, because you'll need to really feel relaxed to sort of get that those hormones moving. So here's my little boob. When you are relaxed, the air is nice and warm, you're feeling really, calm, I want you to start to just stroke and work around the breast. So we don't want to be massaging and kneading at this point. You want you to be just stroking. You can do some sort of little work on the nipple and just get that oxytocin moving, get that really nice sort of relaxed feeling, and get used to feeling your breasts. And you can do this both sides for about a few minutes. Once you've done that, you're going to get yourself into, again, a nice comfy position. And we'll want to be seeing a nice C shape in your hand movement. So use the hand, the arm of the breast that you're going to be working on, and you're going to feel the nipple, come back, probably usually about 3 fingers, but you're going to use your sensation to just feel back to where you start to feel some sort of lumpiness in the breast. So once you get that, you're going to create a nice C shape, and you're going to do this pincer type movement. Okay, I don't want it nice, I don't want it flat, because look, my fingers don't meet. It needs to be like a popper, doing up a popper. So you're going to just feel back over your breast until you can find it feels a bit knobbly. You're going to push your breast back into the chest wall, and then you're going to squeeze those fingers together. And you're going to do this in a rhythmical fashion. Okay. Once you've worked on an area for a little bit, you're going to move yourself round. Okay, again, making sure you're on that knobbly area of the breast, not the nipple. We don't want to be sort of squeezing and pulling. We want to just be pumping. You're going to come round, and then you're going to do the same, come back, and then you're going to C-shape curve, and then you're going to just compress. Okay, now if this is your first time doing this, you probably won't get any colostrum. Some mums don't get any prior to giving birth at all, so don't panic if that happens. This is really good practice, even if you don't get any. But if you do, it will be a very tiny little amount. Okay, and that's why we have these little tiny syringes ready. So what you would do, if you start to see a little bit of the fluid coming out of the breast, you're going to take your syringe, and then you're going to just suck it up into the syringe. Now this syringe can be kept in the fridge in a sterile container for about 24 hours, and you can top it up over 24 hours. Once you've done that, you then pop it into the freezer, again in a sterile container. You can usually use the little packets that it comes in, or a sterile sort of cup or a plastic box. And then that can be kept in your freezer at around -18, well, anything below -18, for about 6 months. So that can be, stored for quite a long time. Okay. Now, if there are any questions or anything you particularly want me to go through with regard to this, then please let me know in the comments. Obviously you do the other side, and then when you do that side, you use this arm as well. So that'll be like that. But This is a really important thing to start to do, just to get used to working with that expression, and also to get some of that real great liquid gold colostrum to feed your baby, which is really good for top-ups if your milk doesn't come in straight away. Okay, so leave some feedback in the comments, let me know if you have any other questions, and that's it for now, and hopefully I will get back to you soon with some more information. Thanks, bye.